a 60-year-old male who presented with high blood pressure. His blood pressure was 160/90, heart rate was around 90 beats per minute. He was 250 pounds, and he was complaining of a lot of multiple complaints systemically. Joint pains, not able to sleep. He was on amlodipine 10 milligrams daily, losartan 100 milligrams daily. His triglyceride was elevated at 250. So when we evaluated him, I asked him about his regular diet. He was consuming a lot of sweetened drinks. Hi, we're going to talk about sugar, sweet inflammation. Pretty much every time he opens his mouth, he said, if there's a sore throat, he drinks Coke. If he's thirsty, he drinks Coke. On top of him being diabetic, it's a lot of processed food, meaning anything that he could find in the counter in the grocery store, he buys it. Sausage, hot dogs, and he eats high processed food like bread, pasta, and rice. So that's his diet. Well, does he exercise? No, because it was very difficult for him to move around. He was constantly sleep deprived. He would average about 4 hours of sleeping. He tells me he's constantly fatigued and he wants to do something about his quality of life. Why sugar has this effect on the body? There are 5 mechanisms that I'm going to share with you. Number 1, it would be that spikes of blood sugar and insulin increases inflammatory cytokines. Number 2, it produces advanced glycated end products, which also causes tissue damage and cause essentially aging. Number 3, it increases gut permeability. Have you heard of leaky gut? That's what it is. And leaky gut cannot exist without dysbiosis, or imbalance of the good bacteria, which is so needed in your health and immune function. The 4th is that sugar is noted to promote fatty liver and inflammatory fat cells, especially in the viscera. That's why waistline is more important for me than weight. So what we did was, first, eliminate the sugar or the added sugar, but for him, because his sugar is already elevated, he has to sleep at least 7 hours a day. He has to start exercising, even just walking 10 minutes. His big struggle was he cannot get rid of Coke. So I related to him the challenge of San Josemaria Escrivá, who said, every time you fast or every time you deprive yourself of sugar for your coffee, imagine how many souls would be lining up to welcome the gates of heaven. And this is the great Saint Josemaria Escrivá, who is also known as the patron for diabetics, because he was a diabetic, miraculously cured from his diabetes. In the first week when he came back, he finally said, yes, that worked. I offered it up for the Pope, for many of my friends who are not in church or has fallen away from the church. Well, guess what? It took a day or two to get rid of his taste for soda. He was so happy. And he said his blood sugar went down to 116. His blood pressure is now 140/90. He lost about 20 pounds just in 1 week. At this point, I decreased the dose of his amlodipine from 10 milligrams to 5. On the second week, we did the same, continuously just reminding him. I followed him up every week. Blood pressure continuously to go down, until by the 3rd week, we agreed that we are going to stop amlodipine and stay on losartan for renal protection. At this point, we also stopped the glimepiride. It is important to stop that because as your weight decreases, your blood sugar also decreases, and with the glimepiride, which is long-acting, you can suffer from hypoglycemia. So when you do this weight management or treatment of metabolic disease like diabetes and hypertension, you have to have an astute physician, a qualified physician. Remember, this gentleman started with 55 inches. By the 3rd week, he was already 52 inches. The 5th important effect of sugar is that it weakens the immune system. So let's go back on why these things happen. When you have high sugar intake, it rapidly raises blood glucose, causing insulin to spike as the pancreas produces insulin from the pancreatic cells, islet cells of Langerhans. And this causes fatigue of the pancreas, which in turn will make the diabetes worse for you. That's why With glimepiride, the mechanism of action is to stimulate the insulin directly to the pancreas. It will fatigue and it will not work eventually. You can keep popping your glimepiride or your glyburide, but it will not work anymore. You'll develop insulin resistance as well. The spikes of insulin and sugar would lead to increased production of pro-inflammatory cytokines like interleukin-1, interleukin-6, CRP. That's why if you're diabetic or hypertensive, you should ask your doctor to have your inflammatory markers checked, especially the high sensitivity CRP. In chronic insulin levels, persistent low-grade inflammation comes in. You will not have fever. When I'm talking about low-grade inflammation is inside in the blood vessels, waiting to just burst and have an acute event like atheroma or blood clot. Eliminate the processed carbohydrates like rice, pasta, even white potatoes. Of course, eliminate the sweetened beverage. Anything that's sweet, offer it up. And of course, you have to have an adequate balance of high fiber diet, meaning vegetables, a minimum of 2 cups of vegetables twice a day, or 4 cups of vegetables per day. You don't need the fiber. It's the microbiome who needs the fiber, because the microbiome needs to ferment these, because the fermentation product, which is the short-chain fatty acids, namely butyrate, acetate, and propionate, heals the leaky gut and also is the food of the microbiome. You need at least 3 trillion species of microbiome, which is assigned to produce healthy substances to protect you. So what about the age that I was talking about? Advanced glycated end products increases or gives you the propensity for tissue damage, especially the vessels of from the brain to your toe. That's why from the brain you can be predisposed to stroke in your heart attack, or in your limbs you can have ischemic or peripheral artery disease. What are advanced glycated end products? In our next video, I will elaborate this. There are many identified. But specifically, it ages the tissue. It makes you weak because the mitochondria of your different systems, for example, the brain, will also become inefficient in producing ATP or the power. Remember, the mitochondria is the powerhouse of the cell. Sugar weakens this. I introduced to him meditation. He said, I didn't like meditation because it's not for me, I'm Catholic. Well, I said, I explained to him that there is a Catholic way of meditation. It goes way back in 400 BC, when the great Saint Anthony of the desert started to do a Jesus prayer. So when he inhaled, he would say, Jesus, Son of the living God. When he exhales, he says, have mercy on us sinners. Of course, this is in your mind. And with my experience, it seemed that after 25 counts of repetition, your brain and your body seem to be more calm and you'll be more concentrated. Now remember, there are 3 phases of meditation in Catholic meditation. Well, there are many meditations the Catholic way, but the way to simplify it is to engage in 3 parts. Number 1 would be concentration. In the concentration part, you're to humble your God. You're to adore Him. So what a fitting way of doing this. When you say, Jesus, Son of the living God, you're adoring Him. Have mercy on us sinners. You're humbling yourself. And if you're doing this in front of the Blessed Sacrament, it's very powerful. Jesus is there alive in the Eucharist. He heals you physically. He was hard on His body. What about you? Offer it up. Just a few steps. Offer it more for somebody who's suffering in the purgatory, or your family who needs to convert or go to the Catholic Church. Then he realized, by putting a transcendental meaning of what you're doing, it became more effective and he was more motivated. Because really, if you don't do things for your health that is not connected transcendentally or offering it up, it would just be in vain. So make some sacrifices, offer it up, stop glucose, increase your exercise like a corporal mortification, and increase your time to meditate. especially in the unconditional love of Jesus. Because Jesus, remember, in the Blessed Sacrament, He is there physically waiting for you to heal you, and He will guide you. If you like this video, please like, subscribe, share it. Share it to your friends who might need this kind of type of discussion. The next topic will be on how to detox holistically, especially during Lent. How the brain can be detoxed, your liver, your kidney, and your soul. Thank you very much.